Today, we're going to be talking about 5 most important things that you need to be job ready. The recruitment campaigns are going to be starting in a few months' time, and it is currently a good time to be reflective of your credentials and how can you really improve your credentials to have that final job offer, your first job offer as an international medical graduate, or your second job offer in an ideal hospital closer to where you live. Remember that concept that whenever you do something, you do for a very specific reason. And I want you to work closely with me on that concept. Whenever employer are trying to offer a job to an IMG, their first job that is, they're looking for a very specific reason of matching the job description in terms of essential and desirable criteria. They're also looking for an outcome. Obviously, they want to have a job full. They also want to run a very fuss-free health service. So there are no complaints against the IMGs, and the consultant and all the team are happy with those doctors. And that can be decided at the process of the application and interview. And finally, they want to deliver a very good exemplary health service in their network. So how can you make sure that through the application process and interview, you match that reasoning and outcome? Let's talk about my number one recommendation in order to be job ready, which is recency. When you're doing recency, you need to make sure that you're addressing certain essential aspect of working in a hospital. You must be a paid resident working through a range and variety of situation, morning shift, evening shift, and even a night shift. You must be exposed to a wide variety of clinical situation, emergency department, outpatients clinic, operation theater, and a ward setting. And obviously you need to tick off those essential criteria that you're working in a ward setting, you're assessing the patient, you're investigating the patient, you're communicating within the team and within the hospital, and plus you're initiating safe clinical management plan. So when the consultant does your reference or that final completion of recency report, all of that is reflected in that. That is the reason you're doing the clinical recency. And when somebody looks at that clinical recency reference letter, it is actually making sense. The second thing is clinical observership. So what is the reason of clinical observership? The reason that you do clinical observership is not to relearn medicine or medical knowledge or medical education. It's to understand the system. If you're doing a clinical observership in a hospital setting, you're trying to learn how the doctors see the patient, assess the patient, how they discuss the patients with their consultant and broader team, how the hospital systems work, pathology, radiology, and referrals, and what's the general manner of conducting yourself professionally. That is what you are looking for in a clinical observership. If you're doing a clinical observership in a GP setting, then you're looking and observing the GP. How is he interacting with his patients? How is he making a referral for an outpatient investigation and specialist review? All that can be a very essential part of your application process. So when you put these detail downs as that you've done a clinical observership in a GP setting or a hospital setting, it comes out in a flawless manner. The third thing is courses. Now, what is the need for the courses? What is the basic reason that you need to do the courses? The basic reason for courses is that you need to display a certain level of skill set. It really hurts me when I see international medical graduates coming to the working with me, and they are unable to put the cannula, they're unable to suture. They say to me that they've never done a lumbar puncture before, or they're unable to put the NG tubes, and all of the basic essential skills which are required at a junior medical officer. Now, it's okay to miss them a few times, but if you are not even aware of how to do the procedure, the steps, then it's not really a good thing, and it is not good reflection on you as a doctor during that term. So make sure that you do a course which makes you updated on the steps and how to do these procedures here in Australia. Also, when you're working as a doctor, it would be very likely that you can meet an emergency in an emergency setting or a ward setting. The patient may certainly deteriorate. There might be an unexpected cardiac arrest. So you should be aware of how to be an efficient member of a resuscitation team. Nobody expects you to run the resuscitation, but everybody expects you to be an essential part of an emergency team. Now, BLS courses, ALS courses, and APLS courses are widely available. And even if those prescribed courses are not available, there are other courses. We do conduct courses in Liverpool Hospital and other hospital in which we give you common medical non-medical scenarios of common ward-based emergencies and how to handle them, the airway management, the breathing, the circulation, the disability. So all of these things, you're aware of them and how to troubleshoot them. Your role as a junior doctor is troubleshooting and being an efficient part of the system. So make sure that you do courses that are reflective of that learning process, the teamwork and collaboration. The fourth thing is AMC Clinical. Now, most of the doctors who are applying for jobs, in fact, 70% of them are AMC 1 pass only. 30% of doctors have actually passed AMC Clinical and MEL, and they do stand a better chance than the rest of the lot to have the job offer, because certain hospitals are very specific that they want application from the AMC Clinical pass doctors only. So by passing the AMC Clinical, you stand a very good chance of having a less competition. So I think it pays to prepare, enroll, and actually pass the AMC Clinical exam if you can, to stand yourself a better chance of having a better job offer closer to the hospital or in a much better hospital. So that is the reason behind having a lesser competition for your own self with the positive outcome of having an excellent job offer. Finally, what about the voluntary work and non-medical work? They are all very relevant. What is the reason behind them? The reason is public relation, communication, awareness with the local health culture. And when you interact, when you communicate with normal members of the community, you are showing or displaying that understanding. You're showing and displaying that you are dealing with people, interacting with them in English on daily basis. That becomes a part of your application process and part of an interview. When they ask you, how are you well adjusted to an Australian health system? You can say that, well, I have done a voluntary work in a GP health setting, being a receptionist. I've also done a voluntary work in a community, working with disabled or aged care. That teaches me how to develop a rapport, how to develop an empathy towards my clients and the people that I provide care for. So I think all of these things make a huge difference. Again, remember, whatever you do, you must have a reason. And the reasons are those facts which you need to tick off. And those facts need to be reflected in your application process. A, to be shortlisted. And B, these facts need to come out as example during the interview process so you finally get your first job offer. Best of luck for this 2023. And I hope this year comes out and turns out to be the best year of your life. Look after yourself and each other. Khuda Hafiz.